Hello, my name is Annette Rubalcaba, and I will be presenting the deltoid of the muscle. So, the deltoid is located laterally from the shoulders, and it's divided up into three parts, which is the anterior, medial, and posterior, in which it makes up the whole deltoid muscle. The origin and the insertion of the deltoid. The origin, it's lateral third of the clavicle and inferior edge of spine of scapula. And as you can see from the lateral view, it starts from the clavicle and it wraps itself around to where it reaches from the scapula, which is posteriorly. And then the insertion is located in the humerus, specifically on the deltoid tuberosity of the humerus. And as you can see from the lateral view, it is medial of the humerus. Continuing on to the origin and the insertion of deltoid, as I mentioned from the previous slide, the origin, it's located lateral third of the clavicle. And as you can see in this picture right here, this is the anterior view of the specifically of the right clavicle. And as you can see, the origin is on the clavicle, but lateral third of the clavicle. And then again, like I mentioned, it wraps around itself to the scapula. And so I have a picture right here. This is the posterior view of the right scapula, and it originates also as well from the scapula, which is inferior edge of spine of scapula. And so for the insertion, as I mentioned as well, it inserts from the humerus. And so I have a picture. This is the anterior view of the right humerus. And where the word deltoid that is highlighted here, it shows that in this little bump right here, on everything that's red right here, as I can say, this is the deltoid tuberosity of the humerus, exactly where it's inserted from the bone. And so the joint that involves with the deltoid is called the glenohumeral joint. And the humerus and the scapula connects with each other, and how they connect to each other is by the head of the humerus. It inserts itself into the glenoid cavity of the scapula, which then makes up the ball and socket joint. So for the daily usage of the muscle and actions of the deltoid, because it's a huge muscle, it has a lot of maneuvers itself. It has a lot of actions. So starting with extension, flexion, horizontal abduction, horizontal adduction, and then abduction. As you can see in these photos, they specifically describe how the movement is how each picture goes through the motions. So starting with the horizontal adduction and abduction, it is on the horizontal line like this. And so adduction is going towards your body, and then abduction is going away from the body. For abduction, it is going away from the body, but by going upwards. And then for flexion extension, we put our arms forward, and so we are at the sagittal plane, and on this we are flexing. This is flexion, and then coming downwards it would be extension. And again, that would be the sagittal plane, and then for the abduction, this would be the frontal plane. And so how we would And so how we would strengthen the deltoid, there are these are the two exercises that I chose, which starting with lateral raises here, we would be standing up, back straight in a neutral position. Grab a weight that is not too light but not too heavy, just right in the middle. And from here, we want to position ourselves by having our palms facing towards the body. And so after we face our palms towards our body, we then want to move our arms laterally. And again, this is abduction, and we want to be at shoulder height. We don't want to go any more than that. We just want to go shoulder height and then control the weight while we're going down. For seated shoulder press, we are seated on the bench, having our back against the bench as well. Feet are planted, and again, using weights that are not too easy but not too difficult, just right in the middle. And so we want to position ourselves by having our palms facing forward with our dumbbells, and then our starting point before we start on the exercise is going to be shoulder height, and then we're going to go ahead and press upwards and then control the weight while we're coming down. And so on how we would want to challenge ourselves, that way the exercise itself is, we want to make it challenging, is by, like I mentioned, like lateral raises, you can hold, rather than holding for a second, you can actually hold yourself for about 2 to 3 seconds and then slowly count about 6 seconds and then going back to the starting position. That's one way to challenge yourself. And for the shoulder press, you can actually add in an exercise with it. So it would be a compound exercise because it's 2 exercises into one. And how that would be is, for this example, I use squatting. And so just like we were pressing like a seated press, we would be standing up for this exercise, and we would go ahead and position ourselves as if we're position ourselves to get ourselves ready to do a squat while we have our weights by our sides. Once we're squatting and once we're coming up after a good squat, we're raising up our arms just like it shows in this picture as the height of our shoulders. And then right after that, we want to raise them up after we're all like standing up straight. And then once we're coming down, we'll be coming down to a squat. And we just repeat this. We'll be repeating this motion. And so on how we want to stretch safely and effectively would be, for one, we can do the stretch that's called reverse shoulder stretch. This is where we stand up straight at a neutral position, put our hands behind our back, and then pull. And then we would be holding that for 30-second stretch. And that's the stretching to work in the anterior delts. The next stretch would be the arm across the chest. That's another effective way to stretch our deltoids. And what we want to do is have our arm come across to where we want our other arm to pull as much as we can. And once we feel a stretch from our deltoid, and then we will hold that stretch for 30 seconds. And that is working from the lateral deltoid. And to make it more challenging, one, just like the arm across our chest, we can go into all fours on the floor. and we want to be opening our chest, just like this picture shows right here of the girl raising her arm all the way to the side, twisting her body to where her arm is raising up to the ceiling and looking towards her hand. And then we're going into we twist again while we're in a sense threading the needle. And so we're threading the needle, we're twisting our body to the other side, and we're facing downward, and we hold that pose for 30 seconds, which then we can get a deeper stretch. And the other stretch that I mentioned, which was the reverse shoulder stretch, just like I mentioned, putting our arms behind our back, and then we're pulling on our hands, and while we're pulling, we want to raise it up as high as we can to feel of a deeper stretch, and we can hold that for 30 seconds. And put this down. Common injuries from the deltoid and causes of them are overuse of the deltoid or a strain. Those are our common injuries there. And what can cause that is carrying heavy boxes or anything that's heavy for our deltoids. And then overstretching, like I mentioned, it is good to stretch. However, we do need to be careful of not overstretching it. That way we don't cause any injuries. It can also be due to an accident that can cause injury to the deltoid and also repetitive movements. And that is my presentation. Thank you.